1 year 8 months old boy. The heart is right ventricle, and ascending aorta and pulmonary trunk is here, and left ventricle and right atrium. If you look, the anterior part of the outlet septum is removed from, so this is the shape of the anterior wall of right ventricle. So this is pulmonary artery is a little bigger than the ascending aorta, and coarctation is mildly present. So from right ventricle, if you look inside of the heart, here is the VSD opening, like this, and there is a hypertrophied outlet septum at this side. So from right ventricular trabecular zone, it may go to aorta like this, like this, and this is ascending aorta, and so go to pulmonary trunk and ascending aorta. So it's a double outlet right ventricle with a subpulmonary VSD. So it's clearly the aorta is right anterior, exclusively from the right ventricle, and there is a thick ventricular septum here, the outlet septum here. And from the left ventricle, we can see mitral valve is here, and mitral valve is in fibrous continuity with pulmonary valve, posteriorly located pulmonic valve. So we can see from this view that this is pulmonary valve, this is pulmonary valve, and this is mitral valve, and there is a fibrous continuity between pulmonic valve to mitral valve. So it's it may be called a complete transposition with VSD. So this is VSD, but in DORV concept, this is VSD. So the outlet septum, in this view, we can describe the ventricular septum as trabecular septum marginalis here, and it is anterior limb and posterior limb, and posterior limb is in alignment with the outlet septum, so that the margin of VSD is anterior and posterior limbs of trabecular septum marginalis, and outlet septum is in alignment with the posterior limb of VSD. And also here is the lateral wall of right ventricle, which is ventricular fold. Yeah. This 7-month-old girl has many different types of cardiac malformation. From the right lateral view, you can see right atrium and SVC, and at the back of SVC, we can see BT shunt from the right brachiocephalic trunk to the right pulmonary artery. And left common carotid and left subclavian arteries branches at the aortic arch. And from left side, we can see persistent left SVC draining to coronary sinus. The location of persistent left SVC is always the in between the appendage of left atrium and left pulmonary veins. So this is a site of ligament of Marshall or persistent left SVC to coronary sinus. When we look at inside of the coronary sinus, we can see a hole here. This is unroofed coronary sinus, which is opening between the coronary sinus to the left atrium. And here is this is artifacture, and here is some opening to the right atrium draining left SVC. If you look at the arterial trunk, we can see clearly the ascending aorta is right anterior and pulmonary trunk is in left and a little posterior, but the relation is not very unusual. So there is a pulmonary stenosis with some the dilatation of pulmonary trunk due to BT shunt. So if you look at the pulmonary valve, you can see small opening of pulmonary valve, which is native. So it's a severe pulmonary stenosis and post-stenotic dilatation of pulmonary valve, and pulmonary blood flow is augmented by the BT shunt. So it's from the right ventricle, we can see the ventricular wall with tricuspid valve and ascending aorta on the right anterior, very big aorta, and pulmonary artery should be here. Here is the expected location of pulmonary artery in this setting, and also you can see anterior papillary muscle on the lateral wall of right ventricle, but nothing on the ventricular septum in this view. But if you look at this shape, it's not very unusual that anterior papillary muscle is in attached to the septum, but the tricuspid valve annulus is overriding, what we call straddling, because the not only overriding, the valve apparatus is partly to the right ventricle, and also the part of the tricuspid valve is on the left ventricle here. So this is a straddled part of tricuspid valve, which is valve apparatus attached to the left ventricle and overriding at the posterior part of the left ventricular septum. Again, we can see mitral valve is here, which is a kind of anterior part. So the division of tricuspid valve and mitral valve is in horizontal, so that the ventricular septum and atrioventricular valve septum is monoline. So the right atrial outflow is both to the left ventricle and right ventricle and left ventricle, and also in mitral valve apparatus is here, and mitral valve is straddling to the anterior part of the outer septum. So tricuspid valve straddling and mitral valve straddling are seen in the same heart. So here is the small pulmonary arterial outflow. So this is a kind of complex anomaly with double outlet right ventricle with pulmonary stenosis and tricuspid valve straddling and mitral valve straddling and persistent left SVC with unroofed coronary sinus and so on. So I'll show again briefly. BT shunt, persistent left SVC, opening between coronary sinus to left atrium, from right ventricle tricuspid valve is partly on the right side, but also partly to the left ventricle. So if you look at from here, this is tricuspid valve orifice. With valve apparatus of tricuspid valve. This is mitral valve. This pulmonary arterial orifice. I suspect this. Eight-year-old boy with double outlet right ventricle. The heart weight was 212 grams. There was a Rastelli operation about 6 months ago, and he died of systemic embolism after vegetation in conduit. This is aorta. This is pulmonary Rastelli conduit. This is right ventricle. Right ventricle give rise to the ascending aorta, and the pulmonary artery was very stenotic here. There is an intracardiac baffle is now removed to show aortic outflow from the right ventricle here, and this is pulmonary valve, almost atretic membranous type, with here is a VSD. This is tricuspid valve. This is Rastelli conduit. Here, as you can see, the pulmonary valve is in between the aortic valve to the VSD, so this is subpulmonary type VSD, and the intracardiac baffle was placed here to make a blood flow from the VSD to ascending aorta through the pulmonary valve. Here is the outlet septum removed to make aortic outflow easier. There was an outlet septum here, which is now removed, and this is mitral valve. From the left ventricle, you can see mitral valve. The mitral valve has caudal attachment to the septum in front of the VSD, which is a kind of straddling mitral valve. This is VSD to the aorta. This is left atrium. Here, as you can see, this is mitral valve and pulmonary valve. There is a fibrous continuity in between pulmonary valve, tricuspid valve, and mitral valve together here. So conduction tissue is here. Here. So intracardiac baffle was easily placed from here to here. So the operation was perfect. and pulmonary outflows also functioned very well, but intra-endocardial vegetation occurred in the artificial conduit from the right ventricle to the pulmonary valve, which is there is a ring with pulmonary valve. This is left pulmonary artery, this is right pulmonary artery, this is conduit from right ventricle to the pulmonary artery. Ascending aorta is here with the coronary arteries and aortic arch. On the right side, this is right ventricle, tricuspid valve, coronary sinus orifice, oval fossa, and SVC is here. This is pericardium adhered to the visceral to parietal pericardium. And this is the left lateral side of the heart with left atrium, mitral valve to the left ventricle. In summary, this is double outlet right ventricle with the subpulmonary VSD, with pulmonary critical pulmonary stenosis of membranous type. The intracardiac baffle was placed in front of the pulmonary valve from the VSD to aorta, and Rastelli conduit was placed from the right ventricle to the pulmonary arteries. This is 4-month-old boy with double outlet right ventricle with subpulmonary VSD. As you can see, here is an arterial switch operation, which there was aorta at the originally aorta arises from here, and pulmonary trunk was in the back of the on this side. So the arterial trunks are translocated to pulmonary trunk is in front of the aortic ascending aorta in this case. So there's an arterial switch operation, and the VSD is closed in the usual way that left ventricular blood flow goes to subpulmonary artery, subpulmonary area, which is now became an aorta. So in the inside of the right ventricle, we can clearly see the ventricular septum, and there is a outlet septum is here, and this is originally aortic outflow, this is originally pulmonary outflow, and the posterior limb of TSM is in alignment with the ventricular septum. So in this case, the inferior margin of VSD and outlet septum is used to patch placement in this case, so that the posterior great vessel, the pulmonary trunk, is the VSD is directed to pulmonary trunk, and then switch operation made this become a neo aorta in this case. So if there is a subpulmonary VSD without obstruction, the best option would be to make a patch close, or it doesn't have to be intracardiac baffle when it is very close. So it's a closure of VSD at the outlet septum area, and then the switch operation will make a neo aorta from original left ventricle. So this is left ventricle, and going left ventricle with mitral pulmonary fibrous continuity. This is 4-month-old girl. The heart weight was 45 grams. Here's ascending aorta. This is pulmonary trunk, which has almost equal size. From the right ventricle, the ascending aorta is connected, and from the left ventricle, pulmonary artery is closer from the left ventricle. This is left appendage. This is right appendage. From the right ventricle, you can see anterior aortic outflow with complete subaortic infundibulum and thick outlet septum between pulmonary outflow and aortic outflow. Through VSD, we can see pulmonary valve from here, and the pulmonary valve is overriding the ventricular septum. From the left side, you can see mitral valve and left ventricle, and mitral valve is in fibrous continuity with pulmonary valve. And also because of the overriding of the pulmonary valve to the ventricular septum, the ventricular you can see right ventricular outflow to the pulmonary valve like this. So it's a kind of reversed tetracephalus. Pulmonary arterial trunk is very big and biventricular connection from the pulmonary artery. Aorta is not small, and coarctation of aorta is not present. This is ductus. In summary, this is a case of complete transposition with VSD or double outlet right ventricle with a subpulmonary VSD, so-called Taussig Bing anomaly. "15-year-old girl with double outlet right ventricle with subpulmonary VSD or complete transposition with VSD, pulmonary stenosis. From right ventricle, we can clearly see aorta arising from right ventricle and also next to aorta is a pulmonary valve here. So there is no outlet septum in this case. So this is the type of VSD is a subarterial type VSD with small bicuspid pulmonary valve behind the left behind the ascending aorta, and also VSD is here. So both great arteries arise from right ventricle, but it depends on where we recognize as a VSD here. If we recognize this as a VSD, this is DORV, and if we recognize this as a VSD, this is complete transposition. So if you look at from the left side, it looks clearly a transposition. The outlet septum is absent here, and there is a bicuspid pulmonary valve, small pulmonary valve with stenosis at the pulmonary artery, and this is mitral valve. And in this case, there is the surgeon. The child was too big, and it was difficult to decide. And there is it tried as a Rastelli, some kind of shunt operation from left ventricle to pulmonary trunk, but it was unsuccessful.